want to thank Barry for opening comments. And again, I sent Deanna a note just saying, great job. I really appreciate her notes and her putting this meeting together. So I'll start off by saying thank you to all of you for coming and joining this meeting. As the lead for our SICI team, as well as Institute for Prevention and Recovery, it's really about providing service. And as I think about providing service to communities, I also think about patients, right? As a physician, when I talk to a patient and a patient tells me about their health, they're actually talking, interestingly, about their access to medical care, their access to healthy food, their lifestyle choices. The patient who I'm seeing in front of me is narrating their physical environment in their community. It's also when in those conversations, a reflection of the social determinants that they're living with, that surround them, that impact their ability to live long and healthy lives. A patient's health narrates their experience with implicit and explicit biases. It also demonstrates what they've encountered based on their race, their ethnicity, their gender, their class within environment, but also within a health system. So, this focus of our work in terms of social impact, community investment, ending racism, diversity and inclusion, all very important. We are a large comprehensive health system in the state, and we cannot underestimate our impact in terms of our social mission. I did want to ask you, Deanna, are you going to image the slide deck or should I be imaging it?
Just let me know when to move forward and I will click the slides.
Okay, if you want to kick it off right now, I'm on the slide number, I believe, 3. So part of our mission and vision for SICI, overall, it's really to contribute to healthy people and healthy communities, right? We want to improve the lives of the individuals who we serve, the communities, as well as throughout the state of New Jersey. And how we do that is promoting environments that address social determinants of care. On the next slide, that says why, Deanna. Again, I don't know if you're showing it because I'm not seeing it. But when you look at why we do what we do, when you think of a person and their overall health, 20% of that person's health is attributed to the quality of care that they receive. But 80% of the individual's health is attributed to the social economic factors that they encounter, which includes education, job, and family support. The behaviors, their healthy behaviors, as well as their non-healthy behaviors, all have an impact in terms of the outcomes and their ability to live a long and healthy life. And when we think about physical environment is very important in terms of the air people breathe, the water they drink, and their housing and their access to transportation, which gives them access to food and access to healthcare. So, we only, in medical school, we're often talked about, quality of care and health, but now the rationale and the awareness of the social impacts on individuals' health outcomes is really taking precedent, which is a wonderful thing. Next slide, Deanna. When we look at Jersey, what's interesting is some stats here. 300,000 children in New Jersey go to bed hungry. Again, we're talking about a large state that has a number of millionaires. I think we're sort of in the top 5 millionaires around the country live in the state of New Jersey. But there are children here who go to bed hungry. We have about 1.2 million New Jerseyans who cannot afford basic needs, housing, food, access to medical care. We have about 1 million residents that are food insecure. Of individuals less than 65 years of age, 9% of them have no access to health insurance. And, when you think about heart disease and cancer, 46% of the deaths in the state are attributed to heart disease and cancer. That's not insignificant. And the thing that I really focus on when I talk to colleagues is ALICE. So looking at asset limited, income constrained, employed, or also the working poor individuals, about 1/3 of New Jersey households fit the ALICE criterion. Next slide, please, Dan. When we look at what our approach is in terms of social impact and community investment, You know, what do we do? How do we operate? You know, and keep in mind, we do what we do based on limited resources. So we have to take a strategic approach to the programs and initiatives that we put in place. Hence, we look at research. Research demonstrates that food and housing insecurity lead to poor health outcomes. And the SICI team engages local stakeholders, taking into consideration health equity, looking at opportunities to support the needs of the various communities we serve. I don't know if many of you, I suspect all of you have heard of Maslow's hierarchy of needs. And that's a theory of motivation, which really identifies 5 categories of human needs and human behavior. The basic need, if you look at the pyramid that's provided, is physiologic. So as a physician, clinician, you know, I have a diabetic patient that comes in and sees me. And of course, you know, I'm taught to prescribe medication, right? To do some education in terms of eating, to talk about exercise, but also to talk about medication. Now, if you look at Maslow's hierarchy of needs, physiologically, that need is most important. So if I'm asking a patient to take medication, but they don't have access to food, they don't have access to water, they don't live in a healthy environment, highly unlikely they're going to take medication, highly unlikely their medical condition is going to improve. So as a clinician, it is really imperative that we take into consideration the patient's holistic condition, not just the issues related to their disease, but how are they managing through their disease state? How are they engaging their community, et cetera? Next slide, please, Deanna. When we talk about our approach, again, you know, it's not just done in isolation. We have social impact and community investment. We have diversity and inclusion. Trina's a great leader of that team for us in the health system. And we have ending racism, which is really Barry's capstone. He talks about this everywhere he goes. Ending racism is so important. Keep in mind here, we can't exclude one and not do the others. They all really work together. They are somewhat symbiotic in many respects. You know, if we really want to address equity and the health equity that you know, we as a health system provide to our stakeholders, we have to look at all in concert. Can't exclude one from the other. To promote health equity amongst our employees as well as our communities, we have to really work strategically as a team. Next slide, please. So basic to our overall mission is the anchor mission. Now, why is anchor mission important? Hospitals frequently serve as anchor institutions and play a major role in the social and economic vitality of their communities. You know, if you are a health system, you can promote employment opportunities. You can, you know, support economic investment as well as business development within the communities. We spend millions of dollars on goods and services in the communities. So we hire local, invest local, buy local. Ultimately, you know, with the increased focus on the socioeconomic issues of the communities that we serve, you know, we are promoting access to health insurance. We are promoting access to preventable and chronic resources to address preventable and chronic conditions. And providing workforce support also gives individuals in our community a sense of purpose. And this is a great health system with a great leader. There's a lot we can do. And I know Bob Taylor is going to talk a bit about that as well. One of the things that we're pretty proud of, and Barry will mention this quite often, is related to the Cancer Institute of New Jersey, which is about a $750 million project. We partnered with Gingoli construction group. I got that one wrong. But what they did is they created a training program for residents, local community in New Brunswick. You know, I don't know the number of individuals. I think it's pretty high. Deanna, of course, might have that data. But I think the reality of us investing in our communities and working with construction companies on the projects that we put in place to advance our comprehensive service is important, and really proud of that engagement with the local construction company. Next slide, please. Volunteerism and employee engagement. We have to, one, keep in mind that we have employees here who are in need of support. They're living with housing insecurity, they're living with food insecurity. So as we talk about community, keep in mind, we're not just talking about the populations in the communities we serve, but we're also talking about our employees, many of whom live in local communities. And as we try to galvanize our support in addressing health equity, we really focus on employee engagement and volunteerism, which a lot of the site leads have taken a leadership role in. Next slide, please. So our strategic pillars for social impact and community investment fall into 4 areas: workforce development, food insecurity, education, as well as access to care and services. Access to care and services is a little bit newer. It's really about providing access to individuals who are uninsured and undocumented, ensuring that they have support to manage their conditions, and to the extent that we focus on our anchor mission, workforce development is very important. Food security, again, we have to keep in mind, if individuals don't have access to food, healthy food, highly unlikely their health outcomes are going to be great. And education, as a large health system, we should focus on educating our community members, educating our employees on various things related to health equity. So a lot of work here in the strategic pillars. 2022 is going to be a big year for us as we really try to hone in on the activities as well as metrics for our services and activities. Next slide, please. The 4 initiatives that I just mentioned, I won't belabor on this. I believe folks will have access to this slide. But workforce development, food security, again, there's several activities that take place in both of those pillars. Access to care and services. We're using the community health needs assessment, which is done annually, which has identified that the feedback from our community has helped us to access care. And not just individuals who have insurance, but individuals without insurance as well. So there's a lot of work taking place in that. And we just hired a VP for health equity who's going to be leading that particular pillar for us. Education, very important. The cost of poverty experience, I think, is a wonderful educational tool. And it really helps us to engage our employees, but also to understand the challenges our patients face. So I know time is of the essence, and I believe I have one more slide coming up. Is that true, Deanna? And this is sort of an ending slide in some respects. It really is that the work that we do in terms of the SICI leads, which are located at the various facilities, is they engage our stakeholders, external stakeholders. They also engage internal stakeholders. We're looking at the metrics and the gaps that have been identified in the community health needs assessment. We're sharing information, individual programs, educational programs with communities, working with partners throughout the state to deliver food, if you will, to deliver programs that will ultimately lead to better health outcomes for our local communities. Our SICI leads, they work very independently, but they also work in concert. I know that sounds a bit confusing. They have to engage stakeholders. They have to get out in the community. Every community is different. And given that difference, they have to have that degree of autonomy to create local programs that make sense for the communities that they serve. But also, in terms of working in concert, our goal for 2022 is identify those issues and concerns that cross all of our communities. So we're doing both very local as well as a very macro sort of New Jersey statewide program in terms of addressing social determinants of health. So I think we have a lot of work ahead of us, and I'm looking forward to working with the dynamic team. I think, Deanna, this might be it for me. Oh, wait, hold on, don't leave. I forgot a new group that has joined our SICI team. This is the Institute for Prevention and Recovery. I am so impressed by this group, so happy that Barry gave me the opportunity to manage and lead this team, but these individuals address patients, members of the community dealing with substance disorder. which is really the pandemic has shown that there's a lot of issues around this. They're dealing with individuals who are opioid addicted as well as nicotine addicted. And as I've come to do more research on the Institute for Prevention and Recovery, I realize they are one of the few, if not the only organization around the country that does this sort of work. Peer recovery is remarkable, and they've been very successful. I'm very happy they're now part of the SICI team.